Hey there, calm warriors. Welcome to our deep dive episode where we crack anxiety wide open, from its sneaky roots to real life freedom. Picture this: you're in a big meeting, heart racing, palms sweaty, brain spinning worst case scenarios. That's everyday anxiety for millions. Modern life cranks it up with money stress, social pressure, exams, jobs. But here's the twist: anxiety isn't always the villain. In small doses, it sharpens focus and keeps you ready. Push it too far? It hijacks your day. Ready to master it with science and simple moves? Let's roll. Global Stats and Anxiety Who 2024 drops a bombshell: over 300 million people live with anxiety disorders. It outruns depression in prevalence. The Lancet 2023 links 3+ hours of daily social media to a 25% anxiety spike. Digital CBT apps? They slash GAD symptoms by 40%, per Journal of Clinical Psychology 2024. Competition, job insecurity, fast-paced living, they all fuel the fire. This isn't just personal, it's a global wake-up call demanding smart science-backed solutions. What exactly is anxiety? Anxiety hits as an uneasy vibe packed with worry, dread, fear, and tension. It often strikes without real danger. Psych pros spot it through physical cues: pounding heart, sweating, trembling, rapid breathing. Cognitive red flags? Endless worry and doom-filled future predictions. Anxiety versus stress showdown. Stress reacts to clear external triggers: exams, bills, interviews. Anxiety brews inside your mind, even with no obvious cause. Stress is short-term and situational. Anxiety lingers, turns chronic, and roots deep. The biopsychosocial puzzle. Anxiety wears many hats. Biology: neurotransmitter imbalance, hyperactive amygdala, genetics. Psychology: negative thinking patterns, mismatched beliefs, childhood scars. Social: economic pressure, cultural expectations, weak support nets. Effective treatment hits all three layers. Psych views: Freud, Beck and brain science. Freud saw anxiety as unconscious conflict, repressed urges from ego, superego clashing. Beck blamed irrational catastrophic thoughts and bleak future lenses. Biology points to amygdala glitches, HPA axis chaos, serotonin norepinephrine imbalance. Genetics loads the vulnerability gun. Anxiety flavors. GAD, non-stop overworry about daily stuff, plus restlessness, fatigue, insomnia, muscle tension. Panic, sudden intense attacks, racing heart, choking breath, fear of dying. Phobia, irrational extreme fear of objects, places, creatures. Social anxiety, dread of judgment in crowds. OCD, looping obsessive thoughts, compulsive rituals to ease tension. PTSD, painful flashbacks after trauma, war, accidents. Symptoms snapshot. Mind, constant worry, irritability, focus struggles, feeling out of control. Body, fast heartbeat, shaky hands, sweating, gut issues, sleepless nights. Untreated long-term fallout. Burnout crashes in, emotional and mental exhaustion. Depression risk skyrockets. Heart and gut diseases tag along. Focus tanks, grades, and jobs suffer. Isolation grows, relationships fade. Decision-making stalls, personal agency vanishes. Root causes. Genes and family history set the stage. Brain chemistry: low serotonin, dopamine dips. Life stressors: divorce, unemployment, exam pressure. Personality traits: high sensitivity, perfectionism, emotional clinginess. Lifestyle traps: sleep debt, caffeine overload, sedentary days, screen addiction. Who feels it most? Kids and teens battle school fears, separation, phobias. Women face double the rates. Seniors stress over health, loneliness, dependency. Chronic illness patients wrestle disease management anxiety. Cutting-edge therapies. Reality therapy pushes personal responsibility and smart choices. Self-compassion dials down self-criticism, boosts acceptance. Biofeedback trains control over body responses. Digital CBT apps deliver self-guided relief. Evidence-backed treatments. CBT rewires negative thoughts, teaches behavior tricks. ACT promotes accepting anxiety while living your values. MBCT uses mindfulness meditation to cut rumination. DBT builds emotion regulation and distress tolerance. Neurofeedback fine-tunes brain waves. Meds for severe cases: sertraline, fluoxetine, alprazolam. Daily anxiety busters. Journal worries, list, analyze, reframe realistically. Move 30 minutes, walk or yoga. Cut screens and negative news. Practice gratitude, note 3 daily positives. Prevention playbook. Teach emotional skills from childhood. Build resilience muscle. Plan life transitions. Create low-stress zones. Screen high-risk folks early. Myth busting. Anxiety isn't weakness. Meds aren't addictive when prescribed right. It won't always vanish completely. Talking doesn't worsen it. Prevention lifestyle. Eat clean, sleep deep, stay active. Nurture supportive bonds. Schedule your time. Practice mindfulness and positive thinking. Sharpen problem solving and resilience. Big picture wrap. Anxiety isn't your enemy, it signals imbalance. Treatment isn't silencing it, it's dialogue. Understand your anxious mind, and you grow wiser, calmer, truer. Final challenge question. Which anxiety sign hit you hardest? What hack worked for you? Drop it in the comments. Like, subscribe, hit the bell, never miss a calm boost. Thanks for hanging out.